Okay, I see still two questions, unless there are other ones coming in, but maybe we are closing to an end now. So this question may be for you, Ingrid. How can you make sure that PRO are reliable while they are not validated by physicians?
Yeah. Well, in fact, patient-reported outcomes, it's the word says itself, it's reported by patient. It's just the patient feedback. It's the voice of the customer, the voice of the patient. So that means it's just the perception and the input from the patient. So it's, in fact, very rich to have this kind of information. And it's not a good thing if a doctor will overrule this kind of information. That doesn't mean that the doctor's reported information is not valuable. It's only that the patient-reported outcome is then additional value, additional data that is generated and can be made use of. Similar to other industries, more and more the voice of the customer is considered. And in that sense, the healthcare is nothing else than the other sectors. It's important that the patient is heard right away, straight away, with the data that he wants to provide, how he sees it and how he feels it.
Yeah, if I can make a smaller comment on that, as a patient myself, like I have leukemia, right? CML, and I've been on Glivec, which is a very efficient medication for the past 10 years. So it's very obvious that the clinical evidence of this medication is excellent, right? It works for a large number of patients, and the outcomes are extremely good. And there's two competitors to that magic pill. So how does one reimburse those three pills, right? Because they all have the same clinical evidence. What's different might be the patient evidence or the real world evidence, as it's sometimes called. So if the patient prefers one medication to the other because there are less side effects, or it's easier to take the treatment because it's only one pill per week instead of 3 pills per day, I don't know. There's many subjective and secondary elements that come into play, and that's where the patient or the real world evidence is a complement to the clinical evidence, especially for competitive drugs which all have the same clinical benefits, clinical outcome.
I'll just add two more resources to help answer that question further. The ISPOR conference, ISPOR, is excellent in providing resources and data around how much data needs to be collected for PRO data and all data, but specifically PROs to have confidence in the data. And also ICHOM is a great international organization that's standardizing outcome measurements around the world and showing the efficacy and value of patient-reported outcome data.